Good morning and welcome to the Senate Committee on Commerce and Labor. Madam Secretary, please take the roll.
Senator Daly?
Here.
Senator Ellison? Present. Senator Flores? Senator Lang? Here. Senator Rogish? Here. Senator Scheibel? Senator Steinbeck? Here. Chair Pazina.
Present. Please mark Senator Scheibel absent excused, and please mark Senator Flores present when he arrives. Welcome to our members of the audience in Carson City, and we actually do have some in Las Vegas today. Welcome, as well as those following us online. Before we begin, we'll make a few housekeeping announcements. First, I'd like to remind everyone to please silence all of your electronic devices while in the committee room. Members of the public may provide testimony in various ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in the place of testifying. If you wish to testify in person, please sign in at the table by the door and leave a business card with our committee secretary. When testifying in person, please turn the microphone on to speak and off to listen, as we have others listening and viewing the meeting in Las Vegas and online. Anyone who'd like to receive electronic notifications of scheduled bills and access to the committee's meeting materials may do so by signing up on Nellis on the legislative website. Committee members will be using their laptops to view those handouts and other exhibits. Please don't view this as a sign of disrespect or inattention. And with that, we are going to go to our first item on the agenda today, and it is Senator Lang Day in Commerce and Labor. And we're going to start with Senate Bill 189, providing for the licensure and regulation of genetic counselors. And you may begin when you're ready. Thank you so much.
Good morning, Madam Chair and members of Senate Commerce and Labor. I'm Roberta Lang. I represent Senate District 7 in Las Vegas. Thank you for the opportunities to present Senate Bill 189, which is a measure that provides for the licensure of genetic counselors in Nevada. This legislation is important for ensuring Nevadans have access to high quality and safe genetic counseling services. However, to be clear, for professionals who are already qualified to perform these services, this bill will not affect their ability to do so. With me today is Samantha Barnes, who is Director of Legislative Affairs and Operations from Carrera, Nevada, as is Dr.
He's on virtual.
And as well as Dr. Parikh, who is a medical oncologist and practice president of Comprehensive Cancer Centers of Nevada. Connor Kane, principal from Carrera, Nevada, is also available to answer questions. Before we start, I want to note that we are proposing an amendment which is available on Nellis. Genetic counselors are healthcare professionals who with specialized training in medical genetics and counseling. They work with individuals and families to access their risks for inherited conditions, interpret genetic test results, and provide support in making informed decisions about their health. Genetic counseling is a powerful tool in the oncology space. For example, a genetic counselor might work with a young woman who has a family history of breast cancer to determine her risk of developing the disease and discuss the pros and cons of genetic testing to preventative measures and treatment options. For individuals and families like myself having kidney disease, genetic counseling was one of the first things my doctor test he did on me when I got the disease, because it helped provide so much information And even as I moved up here to the legislature and went to my new kidney doctor up here in Reno, I'm getting a transplant in the fall, and he said, do you have this marker? Have you had genetic testing? And I said, I have. And we went home and looked, and I don't have the marker, which is not a good thing because it means that I could get the same disease I have now again after I have my transplant. And luckily they can treat that with medicine. But that is just a really great example of why genetic testing is so important. It tells the doctors, it gives them more information about a person's body than we can see from regular blood tests. For individuals and families, these are also life-threatening, altering decisions they have to make. However, not all insurance plans reimburse services for genetic counseling in Nevada because our state does not require licensure to practice. To illustrate, Comprehensive Cancer Centers hired a master-trained genetic counselor to provide these critical services to patients. Unfortunately, the counselor was getting denied reimbursement by some health plans because he was not licensed. At this point, I would like to hand it over to Samantha Barnes, who will provide more details and work through the bill and the amendment that ensures that the bill conforms with genetic counselor licensure model language across the United States.
Good morning, Chair, members of the committee. Samantha Barnes with Career Nevada. Today, I will walk you through the bill as well as the friendly amendment, which Senator Lang just mentioned make sure the proposed bill would conform with model language across the country. The intent with Senate Bill 189 is to create genetic counselor licensure in the state of Nevada. As you heard in Senator Lang's introductory remarks, genetic counseling is a powerful tool that can guide individuals and families to make informed decisions about their health. Unfortunately, our master's trained genetic counselor is getting denied reimbursement by some health plans because he is not licensed, even though Nevada does not require licensure to practice. But these same plans are reimbursing for the same services if they are being provided by the advanced practice registered nurses employed by Comprehensive Cancer who have been accredited through a certificate program. By creating a license, we hope that health plans will reimburse for services provided by our genetic counselor and all of those across the state. To be clear, this is not a new insurance mandate. They are already reimbursing for these types of services. We are just creating the license, so these masters trained and board certified healthcare professionals can also receive the same reimbursement for their critical services they are providing to Nevadans. Now, I will walk you through the sections of the bill. Sections 1 through 5 add genetic counseling to the definition of healthcare providers, as well as defines genetic counselor and genetic counseling. Sections 6 through 10 discuss licensing requirements and board regulation. Sections 13, 15, 19 through 21 make conforming changes to ensure genetic counselors are treated similarly to other healthcare providers under the board's jurisdiction. Section 18 talks about the advisory board and the requirements to serve on that board. Section 23 establishes the fee schedule and the maximum fees the board can charge for issuing or renewing a genetic counselor's license. Sections 26 through 40 handle disciplinary action, investigation, and penalties for unlicensed practice. And finally, Section 48 deals with confidential communications between patients and genetic counselors. On to the friendly amendment, which should be uploaded to Nellis, and copies are provided here at the table. To amend SB 189 to 1, clarify that other practitioners qualified to provide genetic counseling are able to receive assistance from an individual on the same premises where assistance is being provided. 2, ensure that other practitioners qualified to provide genetic counseling are not in any way restricted from continuing to provide those services. 3, modify continuing education requirements for licensed genetic counselors to conform with other states. 4, remove unnecessary language regarding an activity already precluded under the National Society of Genetic Counselors Code of Ethics, which is also codified in the bill and requires non-biased counseling free of coercion. And 5, modify the composition of the advisory board. Now, I will hand it over to Dr. Parikh, who will explain the importance of genetic counseling within the oncology space and among his patients. And Chair, he is supposed to be virtual, And if I may, once Dr. Parikh finishes his testimony, if the committee has any specific questions for him, he does have patients to go see, so if we could get through those first, and then we have Sarah on our team as well, who will also be available for questions. Thank you.
Hi, good morning, Chair Pazina, Vice Chair Daly, and members of the committee. Thank you, Senator Lane and Sam, for giving a update on this very important SB 189 bill. Here at Comprehensive, we're a large facility in Southern Nevada, the largest cancer provider in Southern Nevada, 45 physicians, 19 advanced practice providers, and one genetic counselor who we just hired about a year ago. And as an oncologist, as stated, right, I can't tell you the importance of how important this bill is in cancer treatment. Genetic counseling not only provides the details of the family history and their genealogy, but it helps us make informed decisions about testing. In addition, genetic counseling also identifies mutations that we have drugs that we can target some of these mutations against to try and help treat and also prevent the cancer. It's like going to your eye doctor and saying, hey, if I have an eye issue and I'm recommending these drops, but you can't come see me because I'm not licensed, quote unquote, right? We're not asking for the test to get paid. We're not asking for, and we're just asking for these genetic counselors to be recognized as providers, as stated earlier, which Nevada does not do right now. It's not only just for the patient, it also helps their families. If you have an inherited gene, you would want to know what you can do to prevent that cancer from coming. And these counselors not only treat the patient, but they treat the entire family. They make sure that the right family, that's the right test. They actually end up saving money because you don't have to order the gamut of genetic testing. They can order the specific mutation down to, the mutation that is found if you're carrying that gene set to the rest of the family members. So is it crucial? Yes. Is it important? Yes. Is it preventive? Yes. And then all we're asking is that these genetic counselors be recognized as providers so they can bill for their services. And we sincerely hope that this bill rectifies that barrier to ensure that more cancer patients, as well as patients with other genetic conditions in the state of Nevada, get services covered. Later, my patient Jean will share her story where we found a gene 20 years ago, but she was never properly counseled. Subsequently, she had 4 other cancers that she went through, each of them treated, and she's going to tell her story. But this is why counseling would have been so important for her back then. So maybe I could have prevented some of those cancers. But I thank you for your time. I ask the committee if you have any questions, happy to answer them at this time. So thank you.
And Chair, if so the doctor can get to his patients, if the committee could have any questions, if we could have those now, that would be terrific.
That'd be very kind. Thank you.
Thank you, Senator. Is the presentation completed? Okay. All right. So we'll start with questions for the doctor, and then we'll move to questions for the rest of the presenters. Okay, Dr. Ellison and then Dr. Rogish for the doctor specifically. Okay.
Yeah, thank you. When I went to this bill, when it says in section 1, it talks about the physicians, and it goes through the, dental and everything else. What kind of training do you got to have to do this to get that license? I mean,
So to get a genetic certificate counseling license, our genetic counselor who's going to testify in a little bit, it's a 3-year program at a major university that you have to be a certified genetic counselor, and they have their own boards that they pass. For our advanced care providers, it's a 6-month course on top of their advanced provider training that they have to do. And then they have to take a very rigorous course. The course only accepts, 20 to 30 constituents to get that license from. So it is a training requirement. We're not asking for the advanced practitioner side. We're asking for these specific genetic counselors who've gone through training, gone through college, and on top of that, they've done genetic counseling, training at that college provided by major institutions in this country. And I believe it's a 3-year course. So.
Good morning and thank you. I just have a quick question with regard to pre-authorization. Is a patient required to receive pre-authorization by an insurer before pursuing genetic counseling?
So some insurers do require pre-authorization for these services, and we would certainly handle that. But this is no different than you're going to go see your cardiologist or your kidney doctor or your heart, whatever doctor specialty you see. These providers are specialists in their field. The tests that they order, if they require authorization, we will do that separately. But this bill is only asking that these providers be recognized as providers, which is consistent with the standard in the country. So it's not asking for the test specifically to be authorized. So.
Thank you so much, Doctor. Do we have any other questions for the doctor specifically from the committee? Okay. Doctor, we thank you so much for your time. We really appreciate your testimony today in regards to the importance of recognition when it comes to genetic counseling for insurers. And we understand you have a busy day, and we'll let you get back to it. Thank you very, very much.
I appreciate it. Thank you so much. Thank you.
Do we have any questions for the senator? Okay, so back to you, Dr. Rogich.
Thank you, Senator Lang. My question is with regard to the definition of genetic information. Will it also include not only genetic test results, but also family medical history, participation in genetic counseling, and any other data derived from genetic services? Couldn't read with my glasses on. So.
Samantha Barnes for the record. I do believe we have Sarah with our team virtually, and I think she can answer that question if she's on Zoom. Perfect.
Hi, I do have testimony to provide, but to answer the question that was specifically posed, I think what's really critical is to consider that what the genetic counselor is doing within their services is all HIPAA compliant, is really interacting with patient care and ensuring that patients have an understanding of what is genetic testing, talk about their family history, assess the risks, understand the benefits, risks, and limitations of the genetic testing process. But that service is entirely private and personalized to that particular patient, and that's what genetic counselors are specialized to really understand, comply with, and do. Hopefully that helps answer the question.
Thank you, Chair. What I'm looking at is just ensuring that loopholes are not exploited with regard to using family medical history instead of direct genetic test results to make underwriting decisions. And so that's what I'm just looking for to ensure that the information is broadly defined to protect the patient.
And I can say too that as a practicing genetic counselor myself in the oncology space for 20 years, that it is of the utmost importance that only the information that a patient is presenting to that genetic counselor at the time of the visit is kept confidential as a part of the risk assessment process and as a part of the family history analyzation process, but kept entirely private and not at all implicated in any way prior to or after the visit with that patient.
Thank you so much. That brought a new meeting to phone a friend. If you would like to present a couple minutes of your testimony, this might be a good time to do it, and then we can continue with questions.
Great. Thank you so much. Chair Pazina, Vice Chair Daly, and distinguished members of the committee, my name is Sarah Pierzadeh Miller, and I am the current president of the National Society of Genetic Counselors, or NSGC. I am a practicing clinical genetic counselor with 20 years of oncology experience from the state of Texas. NSGC would like to thank Senator Lang for introducing SB 189, which would establish requirements for the licensure of genetic counselors. We appreciate the opportunity to speak in support of this very important legislation. Certified genetic counselors are healthcare providers with significant training and expertise in human and medical genetics, patient education, and psychosocial counseling, obtained through a 2-year master's level program. We are employed in a wide range of clinical care, academic, laboratory, research, and biotechnology settings. As a part of the healthcare team, we provide information and support to individuals and families concerned about the risk of genetic disorders. The availability of genomic testing services is growing rapidly. Today's genetic tests, which are becoming increasingly more complex, screen for thousands of diseases. Genetic counselors with our specialized training are ideally suited to work collaboratively with physicians and other healthcare providers to deliver high quality, up-to-date genomics services. And importantly, we can make sure that the patients utilizing these services are appropriately educated with personalized information on impact not only to the patient, but also their families. Clinicians and patients need to be able to trust that the genetic counselors they interact with are adequately trained and up to date on the latest genomic information. Licensing genetic counselors will help build this trust. Currently in Nevada, there is no legal standard to assure your citizens that they are interacting with someone who is appropriately representing themselves as a genetic counselor. As the field of genomics grows, there is and will continue to be a need to provide Nevadans with accurate information regarding genetic risk assessment, appropriate genetic testing, result interpretation, and more. Making genetic counseling a licensed profession in Nevada will help protect the public from potential harm that can result from untrained individuals who could provide improper, unsafe genetic advice to patients. Genetic counselor licensing also provides benefits to employers who will be better equipped to ensure that they are hiring individuals who have the appropriate training and education to provide genetic counseling services. To date, 36 states, including neighboring California, Idaho, Oregon, and Utah, have passed licensure legislation. Without enacting SB 189, genetic counselors may seek employment outside of Nevada in states with licensure. NSGC urges the committee to advance SB 189 and ensure that genetic counselors practicing in Nevada meet minimum standards for academic achievement, clinical experience, and skills necessary to deliver high-quality genetic counseling services to Nevadans. We thank the chairman, Senator Lang, and this committee for your attention to this important issue, and we would be very happy to serve as a resource as this bill moves forward. Thank you.
Thank you so much. Do we have any other questions from the committee? Okay, Vice Chair.
Hey, thank you, Madam Chair, and it's not really anything to do with the genetic counseling part. I just wanted to be clear, similar to another bill that we had that was, so in your section 18, where you can have advisory members of the board versus, and I just wanted to be clear, where in your amendment, you're saying you're going to have an advisory council. Are those the same thing, advisory members on the board, or is the advisory council separate from the two sections?
Samantha Barnes for the record. Senator Daly, thank you for the question. It is the same thing. We're just trying to make sure in the language it had a requirement that required the genetic counselors to be licensed for 5 years before they could serve on the board. So since we're just creating the license, they don't have that 5-year requirement. So that's the only thing we're changing there.
Yeah. And you know, thank you for the clarification. I just wanted to make sure, because I know we had another bill where they were creating an advisory council, and I said, give them a job, sunset them. But if this isn't that, then we're okay. All right, thank you.
No, we're not creating something new. Senator Pizzino, or Chair Pizzina, we have 2 other people that wanted to say something, if that's possible. Or we could do it during support if that's good for you too.
If they can keep their remarks brief, we can have them speak right now if they'd like. Thank you. Okay, so please come up to the desks in Vegas. We're going to have broadcast move us out of Zoom and over to Las Vegas. And if we can have those 2 individuals, please approach and broadcast. Thank you. And begin when you're ready.
Hello. Good morning, Chair Pizzina, Vice Chair Daly, and honorable members of this committee. My name is Ali Khalaf, and I'm a practicing genetic counselor at Comprehensive Cancer Centers of Nevada. Today, I'm here to speak in support of Senate Bill 189, which will help improve access to quality genetic counseling services throughout this state. The field of medical genetics has evolved rapidly, transforming nearly every area of medicine. We, genetic counselors, are master trained and board certified healthcare professionals that are uniquely skilled in both medical genetics and counseling. As genetic counselors, we not only guide patients and their families, but we also work very closely with healthcare providers to navigate the complex medical, psychological, and familial implications of genetic conditions and genetic testing. We are integral members of healthcare teams that span various specialties, such as oncology, pediatrics, and prenatal care. We assist in determining the most appropriate genetic tests, interpreting results, and ensuring that patients and healthcare providers understand this. Our role involves providing individualized care, taking the time needed to thoroughly explain complex genetic information. We then help incorporate this information into the broader care plan for that patient. This personalized approach empowers patients and healthcare providers to make informed medical decisions and navigate healthcare with confidence. For some real-life examples, in oncology, a patient was referred to genetic counseling after her sister was diagnosed with early-onset breast cancer. After undergoing genetic testing, it was revealed that she had a BRCA1 mutation, which confirmed that her breast cancer risk was estimated to be at 80%. From there, she was able to make an informed decision to undergo preventative surgery, significantly reducing her cancer risk. This also resulted in family testing for family members, which allowed for earlier interventions and increased surveillance. Another example, in cardiology, a seemingly healthy child experienced a sudden cardiac arrest. After genetic counseling and testing, it was discovered that this child had an inherited but treatable arrhythmia. This resulted in prompt testing and proactive treatment for other family members, which drastically reduced their chance of life-altering events. As the field of genetics continues to expand, it is essential that genetic counselors are recognized as licensed healthcare professionals. Absence of this licensure creates challenges for both patients and healthcare providers and limits our integration into hospital systems, as well as limits our recognition from payers. Licensure also will provide a legal framework that clarifies the scope of practice for genetic counselors, ensuring that patients receive appropriate care from qualified professionals. As personalized medicine advances, we genetic counselors are essential for bridging the gap between genomic research and clinical care. I strongly urge this committee to support Senate Bill 189, which will provide licensure for genetic counselors in this state. This legislation will ensure that patients receive high quality, accurate, and supportive care in a very important and rapidly advancing area of modern medicine. By establishing this licensure, as Sarah mentioned, Nevada will join the 36 other states that have already provided this protection for their residents. Thank you for your time and consideration.
Please proceed if you'd like to provide a portion of the presentation along with your colleague.
Good morning, Chairperson Pazina and members of the Senate Commerce and Labor Committee, and thank you for letting me be here today. My name is Jean Ann Holohan, and I'm here to testify about the critical role that genetic testing plays in cancer and genetic counseling, which would have been invaluable to me. You see, I'm not only a daughter and a wife and a mother and a sister, I am a 4-time cancer patient, a comprehensive cancer. In 1998, my sister was 34 years old, my youngest sister, and she was diagnosed with invasive breast cancer, stage 3. I decided that even though I'm too young to even have a mammogram, maybe I should get tested. So I went, and I was positive for ductal carcinoma in situ. I underwent a lumpectomy and 32 rounds of radiation. And because I was in an HMO, I never even saw an oncologist before I had my treatment, much less a genetic counselor. 9 years later, I had a second primary breast cancer. And I had surgery, chemo, and radiation. By then, my sister had been genetically tested, and she was positive for the BRCA2 gene. I thought, I better get tested too, and I was positive. What should I do? What did it mean? Was it even real? I had a hard time believing that something like that existed. A few years passed, and along came my third round of breast cancer, and I decided it's real, and I had a bilateral mastectomy. During this time, I was being monitored, and in December of 2022, my blood test showed that my tumor markers were rising. And I have to tell you that Dr. Parikh was like a dog with a bone. He said, you have cancer somewhere, and I'm going to find it, and he did. And I was tested. Further testing showed that I had stage 1 pancreatic cancer, which is also part of the BRCA2 gene. If I had received genetic counseling alongside the testing, I would have better understood the long-term implication of cancer and what that meant for me, and not just for me, but for my family. My family's experience further highlights the need for genetic testing and counseling by licensed counselors. My mom has 5 daughters. 2 of us have tested positive. My sister's daughters, one is 33 years old. She just underwent chemo, radiation, and a bilateral mastectomy. Her sister, who's 28 years old and a pharmacist, she went for genetic counseling, and they told her, well, go home, we'll watch you. And because she knows how it's happened for the rest of us in the family, she said no. She said, I want a mastectomy, and she's scheduled for April. It just, like we were talking about earlier, it just shows the need to have licensed people who are giving accurate and up-to-date knowledge. The other thing that I'm wondered about is I have 3 sons. What does the BRCA gene for them? I'm having a hard time convincing them that it's real. So we need those genetic counselors who can tell us what's next and convince my sons that the threat is real. In closing, understanding genetic cancers and genetic risks really empowers people to make good healthcare decisions. It also helps to reduce healthcare costs because early detection means early treatment. So in closing, I just want to say thank you for allowing me to be here and share my story.
Thank you so much for sharing your story. I did have a question, and it may be for Ms. Pirzadeh Miller, who I believe is still on Zoom. And it came from one of our committee members across the hall right now who is interested as well. But does genetic counseling include prenatal screening?
Thank you for the question. Genetic counselors can serve all areas of medicine, including healthcare in all realms, prenatal healthcare, oncology, neurology. We heard about renal disease as well. So many different areas, but yes, that is a subspecialty that genetic counselors do serve.
Thank you so much. And with that, do we have any further questions from the committee? I know we've already had a few. Okay. So with that, we thank you so much for your presentation on Senate Bill 189 and for the presenters who were able to join us on Zoom and in Las Vegas. And we will open this up to Senator Lang. If you want to stay there, I think that's okay. Yeah, that's fine. And we can have others join us on either side of Senator Lang for testimony in support of Senate Bill 189.
Good morning, Chair, members of the committee. Michael Hilderby on behalf of Renown Health, here to support the bill today. As you've already heard, genetic counselors are important members of the healthcare team for many specialties, including prenatal, pediatrics, and oncology. You've already heard 35 states have enacted licensure requirements. In states without licensure, genetic counselors may still practice, but the absence of regulations means there are no standardized requirements. This lack of oversight can lead to less than optimal service that we're hoping to see here. Again, you've heard most of this, so I will not belabor it, but we're happy to support the bill today. Thanks very much.
Good morning, Chair Pazina, Vice Chair Daley, members of the Senate Commerce and Labor Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association, the oldest and largest organization representing physicians in our state. We'd like to thank Senator Lang for bringing forth this bill, and we've worked with the stakeholders to address our initial concerns and appreciate the amendments brought forth. Many of our members in the fields of obstetrics, gynecology, oncology, neurology, and more utilize genetic counselors in their practices, and they are a valuable part of the healthcare team. We appreciate this bill bringing licensure, regulation, and clarity to this important profession, and we're in full support of SB 189. Thank you.
Thank you so much, Doctor. We'll have those come forward in Las Vegas as well who'd like to testify in support of Senate Bill 189. And after we are in our physical locations, we will move to the phones.
I'd like to thank the members of the committee. I'm Mark Nunez. I am a clinical geneticist and pediatrician. I am the director of genetics, genomics, and metabolism at Cure for the Kids in Las Vegas. I endorse the statements by the prior speakers and support Senate Bill 189 to promote quality, provide accountability, and permit efficient collaboration. Thank you.
Thank you. And can you please spell your name for the record? Turn that microphone back on for me so that we can hear it here in Carson City.
Nunes, Nunes.
Thank you so much.
Good morning, members of the Senate. I'm here to support Senate Bill 189. I am a pediatric cardiology genetic counselor here in Las Vegas, and I am representing Children's Heart Center of Nevada. We fully support this bill and believe it is very important for protecting the residents of Nevada and for expanding genetic services.
Thank you. And can you please share your name and spell it for the record?
Yes, it's Julia Prinzi, Julia Prinzi.
Thank you so much. All right. Do we have anyone else in Carson City or Las Vegas? Not seeing anyone right now. Let's go ahead and move to the phones. Broadcast. Do we have anyone on the phone lines in support of Senate Bill 189?
If you would like to testify in support of SB 189, please press star 9 or raise your hand in your Zoom window to take your place in the queue. Caller, you may go ahead when you're ready.
Good morning, Madam Chair and members of the committee. For the record, my name is Carrie Harrington. I'm the director of Nevada Cancer Coalition, and that's spelled C-A-R-I, last name H-E-R-I-N-G-T-O-N. SB 189 will help to ensure Nevadans receive genetic services from individuals who have attained the highest level of competency and professionalism available in the field of genetic counseling. And it helps expand our drastic shortage of healthcare workers. As such, our coalition strongly supports the passage of SB 189. Thank you.
Thank you so much. Broadcast. Do we have anyone else on the line?
Chair, the line is open and working. There are no other callers at this time.
Thank you so much. Seeing no one else in Carson City or Las Vegas to testify in support, we will move to testimony in opposition of Senate Bill 189. And I would also like to say thank you to all of the healthcare workers and heroes who've been here to testify on this bill today. And with that, if there's anyone in opposition, please come forward in Carson City or in Las Vegas. I think they're scared of you, Senator Lang, sitting at the table. They're not going to come. All right. Broadcast, do we have anyone on the lines?
If you'd like to testify in opposition to SB 189, please press star 9 to take your place in the queue. Chair, the line is open and working. There are no callers at this time.
Thank you so much, Broadcast. All right, with that, we will open it up for testimony in neutral of Senate Bill 189. Please come and join Senator Lang at the table in the front in Carson City or join us in Las Vegas. Thank you.
Thank you, members of the committee. Adam Plain with the Nevada Division of Insurance submitted written testimony. I just wanted to reiterate on the record the testimony from Senator Lang and the other proponents. I think made it clear that the impetus for the bill may have started as insurance issues. After reviewing the bill, really the only changes in Title 57 are in Section 58 and 59. The division views those as very minor, doesn't see any issue with the bill as written. I've had a chance to briefly review the amendment. The amendment doesn't affect Title 57 either, so we are perfectly neutral on this bill.
Thank you very much. All right, anyone else in neutral in Carson City or Las Vegas? Broadcast, what about the phones?
If you would like to testify in neutral for SB 189, please press star 9 or raise your hand in your Zoom window to take your place in the queue. Chair, there are no callers at this time.
Okay, thank you so much. Would you like to make any closing statements on Senate Bill 189?
Thank you, Chair Pazina. Sorry for the disruption in our presentation with the doctor having to leave early and get back to his practice, but we appreciate your indulgence. And thank you to the committee. I just think the future of medicine is genetic testing, and we can, as you heard from our person that testified about what she went through with the gene, testing and stuff. It is so important, and we can save lives, and this is just a really great example of what genetic testing can provide for the future. Thank you.
Thank you so much. And again, we thank all of the healthcare workers who live their lives in service to Nevadans trying to help them. So thank you so much to everyone who testified and shared their story. And with that, we will close the hearing on Senate Bill 189 and open the hearing on Senate Bill 246, also with Senator Lang and any co-presenters that you may have. Okay, well then we will get started. Thank you so much.
Okay, Chair Pazina, thank you again. I'm Roberta Lang, representing Senate District 7 in Las Vegas. It's my honor to present Senate Bill 246 today. This legislation was brought to me by a constituent who wanted to go to her gynecologist, they told her she couldn't do that because she had to first see her primary care doctor. She's on an HMO, and so after some research, I found if you're on a PPO, you can go to your gynecologist. You don't have to have a referral. But for the people who can't afford to have a PPO and have an HMO, to have to go to a doctor and pay the money to see their primary care doctor and then go to the gynecologist, it just didn't seem right to me. And so this legislation is going to increase essential gynecological and obstetrical services for women by removing unnecessary barriers to set up by their health insurance plans. While prior authorization aims to reduce unnecessary care, it may limit or delay medically necessary health care. Health insurers routinely use prior authorization for referrals in fields which create significant barriers to timely care. This is particularly concerning in fields such as gynecological oncology, where delays can impact survival rates. Studies show prior authorization can result in an average delay of 2 weeks for cancer care, with over a quarter patients experiencing such delays during their treatment. In another large cohort study on the use of prior authorizations in gynecological oncology care, researchers found insurance and racial disparities occurred in prior authorizations. Specifically, the findings show female patients with Medicare Advantage plans had a 76% increased risk of experiencing prior authorization, and female patients of Asian descent had a 60% increased risk. Further, prior authorization processes can be opaque and unpredictable, complicating decision-making for both physicians and patients. Senate Bill 246 seeks to address these issues by expanding the requirement for direct access to gynecological and obstetrical services. Chair Pazina, with your permission, I will briefly summarize the bill. In Nevada, we have statutes requiring certain public and private health insurers to directly authorize gynecological and obstetrical services without prior authorization or referral from a primary care physician. Sections 1 through 6, 8, and 9 additionally apply the requirement to health plans that provide medical care to certain private sector employees of small employers and their dependents, benefit contracts issued by fraternal benefit societies, managed care organizations, the Public Employees Benefit Program, and Nevada Medicaid. Section 7 makes a conforming change, and Section 10 makes the bill effective on January 1, 2026. Regarding the fiscal impact, I would like to state that the 3 entities who submitted a fiscal note indicated they would have no fiscal impact if this bill was implemented. Thank you, and I stand ready for questions.
Thank you so much, Senator Lang. Do we have any questions on Senate Bill 246 from the committee? Yeah, I think probably the gentlemen on this committee are a little nervous about asking questions about the importance of gynecological exams and getting pre-authorization. Understood. Okay. With that said, it looks like we have a quiet bunch this morning, and we are going to move to, and you can stay where you are, but we're going to move to testimony in support of Senate Bill 246. Please come join us in Carson City or in Las Vegas. All right, we're going to head to the phones. Broadcast, do we have anyone on the phones in support of Senate Bill 246?
If you'd like to testify in support of SB 246, please press star 9 to take your place in the queue. Chair, the public line is open and working. There are no callers at this time.
Thank you so much. I think we finally found a way to silence the room, talking about our gynecological appointments. Okay. Let's move to testimony in opposition of Senate Bill 246. Anyone who'd like to testify in opposition, please join us.
Good morning, Madam Chair and members of the committee, and Madam Senator Lang, whom I deeply admire. My name is Sarah Adler with Silver State Government Relations, and I represent, you may be surprised, the American College of Obstetricians and Gynecologists, the Nevada section. And so we are here in regretful or unfortunate opposition at the moment. I hope that we can work with the sponsor to remove this. Overall, this is an excellent bill in its intent. And I learned from Dr. Tim McFerrin, who arrived back from DC at midnight last night, that's why he's not here, the importance of immediate OBGYN care. For example, a fetus that the amniotic fluid isn't evident in ultrasound and another ultrasound is needed frequently in order to make sure the baby is still safe. Waiting for prior authorization for that could be life-ending. However, unfortunately, the bill as it is written now, in each of sections 2, 4, 6, and a similar paragraph in section 9, the second paragraph in each of those sections, appears that it is written to prevent a woman with that form of insurance, fraternal or that health plan, from identifying her OBGYN as her primary care physician. And so this appears to be in conflict with federal law. It is certainly in conflict with federal practice and policy. For example, the Affordable Care Act, Medicare, Medicaid, they recognize pediatricians, internists, and OBGYNs as primary care physicians. The U.S. Department of Health and Human Services recognizes OBGYNs as primary care. They do this, they recognize OBGYNs as primary care in their workforce models through the Health Resources and Services Administration. CMS defines primary care as health services provided by physicians, including OBGYNs, who maintain long-term relationships with patients. ACOG information shows that around 50% of women in the U.S. identify their women, let me say, of reproductive age until perhaps they need a gerontologist. I feel like I'm getting there. Utilize OBGYNs as their primary care physician, and that makes sense, right? Because it's a win-win. During your annual visit, your what ACOG calls a well woman visit, you may receive care and a screening that may identify something early that could prevent serious harm and cost later. I've probably gone over 2 minutes. I apologize. So we hope to work with the sponsor, but let me just say, in closing, with the extreme shortage of primary care physicians that we have in Nevada, this doesn't seem like a
Ms.
helpful
Adler, can I
provision.
ask a question?
Sure.
If that section were to be removed, the space in reference to the primary care physician, would the association then be in support of the bill?
110%, as would the Nevada Medical Society.
Okay, thank you so much. And I'm sure conversations have been ongoing, and thank you so much.
I must say, we came to this bill late. I've been working on on a syphilis prevention bill that's being heard this afternoon. And so I did not identify this concern until just a couple days ago, and I apologize.
Okay, thank you.
Chair Pazina, Senator Lang for the record. We discussed this on the way in, and I think we can be able to come to a compromise and fix it.
Wonderful. Thank you so much.
But I also wanted to know if council might have something to say if we need to do that.
Thank you, Chair Jeff Coulomé from the Legal Division for the record. I can't speak off the top of my head to the federal law considerations from memory, but what I can say about this bill is that these provisions in the existing chapters, for example, in 695C 1713 in the chapter about HMOs, these have been in our state law since the late 1990s, and the provisions that we're expanding into the additional chapters in the bill here are modeled on the existing state law that we've had on the books for quite some time. I can't speak to the history because I didn't work here in the 90s of the genesis of those provisions. We could certainly look into it if there's a more specific question or concern, but I just want to make clear that the sections of the bill are modeled on the existing state law that we already have, I think, in about 4 other chapters already.
Thank you so much, Mr. Coulomé. And if we could find out if there's a federal provision as well, that would be wonderful. And we really thank you. And Senator Lang, we thank you because we always know that you work and try to build consensus and ensure that we have the best legislation possible to move forward. So we thank you for that. Is there anyone else who'd like to come up in opposition of Senate Bill 246? Okay. Broadcast, do we have anyone on the phones?
Chair, there are no callers at this time.
All right, we are going to move to neutral on Senate Bill 246. And it looks like we have a couple people to join you at the table. And then after that, we'll move to the phones.
Good morning, Senator Pazina, Chair, and Committee. Shelley Capurro, representing the Nevada Association of Health Plans, which is a 10-member organization for health plans in both the commercial and public sector. And we worked with the senator yesterday. We're just trying to make the bill more clear. So we have proposed language in sections 2, 4, 6, and 9. So if I could just quickly, they're very short, read those. Do you mind? Okay. Section 2.1 currently reads, a carrier that offers or issues a health benefit plan shall include in the plan a provision authorizing a woman covered by the plan to obtain covered gynecological or obstetrical services without first receiving authorization for a referral from her primary care physician. And we would like to offer, just to make it, again, more clear, Section 2.1, a carrier that offers or issues a health benefit plan shall not require a woman covered by the plan to obtain a referral from her primary care physician for covered gynecological or obstetrical services, period. And then in Section 4.1 has to do with a society that offers or issues benefits. And what we would like to offer in Section 4.1 is a society that offers or issues a benefit contract shall not require a woman covered by the plan to obtain a referral from her primary care physician covered gynecological or obstetrical services, period. And then in 6.1, that has to do with the MCO organizations. And in 6.1, we're offering a managed care organization that offers or issues a healthcare plan shall not require a woman covered by the plan to obtain a referral from her primary care physician covered gynecological or obstetrical services, period. And then lastly, in 9.1, again, and this has to do with Medicaid. In 9.1, we are offering the department shall not require a woman who is a recipient of Medicaid to obtain a referral from her primary care physician for covered gynecological services, period. So we just feel that this would be so much more clear. And okay, good. And the senator agrees. All right, thank you so much for your time.
Thank you, members of the committee. Adam Plain with the Nevada Division of Insurance. The division's neutral on the bill. As Senator Lang mentioned, we submitted a no fiscal impact to the agency. I did submit written testimony, wanted to clarify on the record that we did evaluate this proposed bill for federal defrayal considerations, and we do not view this as a new mandate triggering federal defrayal. So we've put that on the record as is. I also did want to kind of chime in, if you will allow me, on the ongoing conversation about language. As Mr. Coulombe mentioned, the proposed language is a copy of what's already in statute. For example, I was looking at NRS 689A.0413. The language that's being proposed currently is identical. As Mr. Coulombe also mentioned, it's unchanged since 1999. A lot of times, as the federal law changes, we try to update the Title 57 to accommodate, and Title 57 is over 60 chapters. It's quite big. We miss things. So I might suggest, if Senator Lang is receptive to it, if the committee is receptive to it, if there's an amendment to change language in the existing bill, that maybe some of these other chapters, 689A, 689B, 695C, 695B, also be opened, and the existing statutes be changed to match what would be proposed in this current bill. So that way the mandates for obstetrical and gynecological services in all 8 chapters that contain them are the same. And we don't have 4 chapters with old language and 4 chapters with new language. And if there are any questions, I'd be happy to take them.
Senator Lang, for the record, I was going to ask that question at the end, so I'm glad you brought that up. And I think when we have an opportunity to update language in our law with current law, we should do that.
Okay, so seeing no further questions, thank you so much. All right, broadcast, do we have anyone providing neutral testimony on Senate Bill 246 over the phones?
The public line is open and working, and there are no callers at this time.
All right, Senator Lang, any closing statements?
Senator Lang, for the record, no, thank you for your time. I really appreciate it. I think this will help with some of the racial disparities that are in healthcare so that women can get the care that they need in a timely manner.
Thank you so much. And with that, we will close the hearing on Senate Bill 246, and we will now move to the final item on the agenda, which is public comment. Members of the public may provide public comment in person, by phone, or submit it in writing to the committee's email. Instructions for providing public comment may be found on the agenda, including the call-in information. We look forward to hearing your comments, and please do clearly state and spell your name for the record when you begin. With that, is there anyone in Carson City who'd like to make public comment? I don't see anyone in Las Vegas, so I'm going to guess that's a hard no in Vegas. Broadcast, do we have anyone on the phone line?
If you'd like to provide public comment, please press *9 to take your place in the queue. Thank you, Chair. The public line is open and working. There are no callers at this time.
Thank you so much. With that, we will look forward to seeing everyone on Friday, March the 14th at 8 a.m., and this meeting is adjourned.